Well, this week on Healthier Together, Regence BlueShield sharing advice and tips on when to go to your local urgent care clinic.
Whenever we have an injury or an illness and we think we need to be seen, pretty quickly, the first instinct is to think about an emergency room or an ER. But actually, there are several other options of places that you can be seen to deal with more minor, non-life-threatening emergencies. These include sometimes your primary care provider's office, especially if they have extended hours. We have urgent care clinics. We have telehealth options, which can include telephone, online, or app-based services. In general, if you're experiencing what you think is a life-threatening, severe injury or illness, the ER is always the best place to go. But so often we have problems or conditions that aren't clearly life-threatening, and that's where an urgent care can come into play. Urgent care clinics are able to evaluate you. They can check your vital signs. They can also run lab tests. Oftentimes they can do imaging tests. If you have a cough and you need a chest x-ray, that can happen there. ERs tend to be overused, and this is a problem for all of us because as the ERs get crowded, it takes away space for people who are having true severe emergencies. We know that about a third of people who go into an ER right now don't have a condition that really requires that level of care, that highest, most severe emergency level of care that an ER can provide. And we know that about 14% of people have no primary care provider and see the ER as their only and main source of health care. So the advent and the increase in urgent cares really are to try to help be more convenient and allow us to treat these conditions and save the emergency room for the really severe, most urgent needs. The best plan is preparation and having a general idea of what resources are available to you. So hopefully this discussion would prompt you to talk to your primary care provider, look with your health plan, and get a sense of where are the care locations near you, where are their emergency rooms, and where are their urgent cares. How do those urgent cares work? Can you schedule an appointment pretty easily? Can you walk in? Do they provide services for children under 12, under 6? These aren't necessarily things that you have to go do a whole lot of investigation about. Oftentimes this information is provided to you by your primary care provider or your health plan. So, over the last several years, we've seen this huge proliferation of a variety of different places that you can receive care, and especially through the COVID pandemic with the addition of more telehealth providers and new alternative different types of clinic sites popping up. It can sometimes feel overwhelming, but overall all of this variety and these choices are ultimately to our benefit to give us more options and more ability to find the right fit. When in doubt, it's best to just remember that there are resources available, do a little bit of pre-planning, take advantage of the resources that your provider and your health plan are offering to you to be able to figure out where is the best place for you and your family.
All right, for more information on this story, you can head to fox13seattle.com/healthiertogether.